Hey, it's Dr. Sara. I hope you're doing well. I am working on a slide deck on cardiovascular disease. I've been working on it for a week, like 8 hours a day. And so my mind is so full of the issues of cardiovascular disease, of which coronary heart disease is the #1 killer in the US and globally. And so as I go through the data, as I parse the data, and I look at some of the differences between men and women, I just thought I would shoot a quick video and talk about some of these differences. You know, I think a lot of people don't realize that coronary heart disease, CHD, includes a few different conditions. It includes coronary artery disease, it includes acute coronary syndrome, it also includes myocardial infarction or heart attack, and angina. This is a separate category within the larger category of cardiovascular disease. So cardiovascular disease, what does that mean? Well, it's coronary heart disease, but it's also abdominal aortic aneurysm. It's TIAs and cerebral vascular accidents, strokes. It's peripheral artery disease. It's congestive heart failure, diastolic dysfunction, which shows up differently in women versus men. So that's cardiovascular disease. And I think it's important to understand this difference between coronary heart disease, which kills the most people, with cardiovascular disease, which is the broader category. So the #1 cause of cardiovascular disease in the US is high blood pressure. And so I hope during the pandemic, you're actually checking your blood pressure occasionally. If you haven't been to the doctor for a while, I just want to encourage you to get your blood pressure checked regularly. The guidelines for what's normal have changed. They changed in 2017. Maybe I'll make another video about that. But I think it's important to realize that high blood pressure puts people in the US, as well as the rest of the world, at greater risk of developing COVID-19 and also greater mortality. So tracking your blood pressure, I think, is very important. And it's hard to do that in the healthcare system right now. And so I'm actually checking my blood pressure at home with a device that I have. Not everyone needs to do that, but it's something to think about, because we know that this is the #1 most important risk factor for cardiovascular disease, and yet it's often unrecognized. And we even know that hypertension shows up at higher rates. It's more prevalent in men until age 50. And after age 50, it's more prevalent in women. So women need to be aware of the risk of high blood pressure. They need it treated. We know that the number of people who have it adequately treated is greater in men versus women, especially in the older age categories. So we've got to change the way that we approach high blood pressure. I think of high blood pressure as being something that we want to address with lifestyle changes first, and then medications, pharmaceuticals as needed. One of my mentors, Mark Houston, has a book on hypertension. I think it's really excellent. He talks about the exercise and the foods to eat and the supplements to take, and I think that can be a really helpful approach. So I encourage you to take a look at his book. So high blood pressure puts people at greater risk for COVID-19 and also mortality. And we don't completely understand why. We need to understand why. And that's one of the truths that I hope will come out of the current pandemic. So a few thoughts on cardiovascular disease and coronary heart disease that I wanted to share with you today. And I'll make some more videos on high blood pressure. Let me know if you have any questions about cardiovascular disease. Do you have cardiovascular disease in your family? We know that coronary heart disease is actually on the rise in younger women between the ages of 35 and 54. So this is something that we all need to be paying attention to. So that's my public service announcement for the day, based on the slide deck that I'm making that I never seem to be able to finish. Okay, guys, take care.